Hi everyone, welcome to researchmd.com. We got another great presentation today. We're going to look at treatment of fatty liver disease with a calorie restriction. We're going to look at the scientific evidence, all this about research and the evidence based on the science, okay? To introduce myself, my name is Pramil Cheriyath, and I'm a physician. I've been doing research for a very, very long time. I got a master's in clinical research. I also work as a program director in internal medicine residency program, transitional residency program. I teach medical students and the medical residents all day, and then I'm also director of research. I'm also assistant professor of medicine at Hackensack School of Medicine. Now, so today we're going to look at this article published in the Journal of Hepatology. You know, the impact of caloric restriction, like intermittent calorie restriction, or they also use the low carb, high diet, and what is the relationship? Is there any decrease in the fatty liver? It's a study we're going to talk about it, okay? So what is fatty liver? I mean, sometimes you go to the doctor, they did a scan, they found out you got fat on the liver, you get kind of worried like what's going on. So it's accumulation of fat in the liver, and when anything accumulated on the liver, especially the fat, it can cause damage to the cells and become fibrous tissue. There may be scarring and all kind of things can happen, okay? So background. So what is fatty liver? There is a non-alcoholic fatty liver disease. That's what we're talking about today. So nothing to do with alcohol. Alcohol does not cause fatty liver in this patient. This is for non-alcoholic fatty liver disease. 25% of the world population. Imagine that. 1 in 4 have this disease, fatty liver. It is closely associated with obesity, diabetes, and metabolic syndrome. What are the consequences of it? It can lead to liver cirrhosis, liver cancer, and the liver failure also. Okay? So, objective of the study, when we analyzed the scientific paper, and we're going to tell you what's our findings very clearly so everyone can understand. That's the whole purpose of this video. To compare, the objective of the study, to compare the effects of 5-2 caloric restriction diet versus low carbohydrate, high fat diet, and standard of care. So we got 3 group of intervention and group of people. We have to make we compare these 3 groups and see what is the difference. Is there a decrease in the fatty liver incidence in these people? Now, so we talked about the first one. What is 5-2 diet? Okay. So 2 days a week you go for a calorie restriction. That's the main thing. Yeah, 7 days a week, only 2 days you're going to do calorie restriction. Other 5 days, again you have small calories restriction. So the 2 days, you can pick any 2 days, you're going to have 500 calories per day for women and 600 calories for men. What about the rest of the 5 days? There's a maximum. You can have 2,000 calories for women, and if you're a male, you get extra 2,400 calories. Okay? So 5-2 diet, only 2 days calories restriction. The other days, a little bit restriction, but you can eat more calories. Now, what is a low carbohydrate diet? Women can eat 1,600 calories per day, men around 1,900, consists of 5 to 10 carbohydrates and 50 to 80% fat, 15 to 40% protein. In the low carbohydrate diet, we talked about it, and the standard of care also, what we have is you get the advice from the hepatologist, and you are told to reduce the intake of sweets, increase the food, increase the food source like unsaturated fat, avoid large portions, and regularly eat 3 meals per day. Only the advice by the hepatologist gone by the standard of care. Now, what is the timeline? So the study was started in 2017 and it went all the way to January 2020, okay? That's 28 months. So more than 2 years they followed this group of people. Now, measures of the outcome. What are the outcome they looked in the study? Hepatic steatosis. They measured this by magnetic resonance spectroscopy, which have like 89% sensitivity and 84 specificity. So it's a very good test when you have higher sensitivity and specificity. The liver stiffness also, we are like the higher sensitivity 84.8 and specificity of 93.6. And there's something called CAP score they measured, and that also has sensitivity of 85%, specificity of 74%. It will give you a clear picture of how well your liver looks. Okay, you don't need to go and get a biopsy, like to again look it under microscope, but there are like other tests we can do to find out about the status of the liver, and those are the three things they did: hepatic steatosis, liver stiffness, CAP score, and they also looked at in many things they looked at it, but we're just going to look at the only specific to liver. They also looked at the liver enzyme, AST and ALT also. Okay. Now, so let's look at our population. The study was done in Sweden. That's also another strength of the study. They have a very good large database, and if you look at most of the European studies, they're well funded and by the government. There's not usually they don't have that much pharmaceutical involvement in their studies. I've seen that. So they have 74 participants. They were all randomized, and they put into 3 groups, like we said before: 25 people in the 5-2 diet, 25 in this low carbohydrate, and 24 in the standard of care, which is recommended by the hepatologist. Now, let's look at our results. The most important thing. The first thing, they look at the hepatic steatosis. So you can clearly see the 5-2 diet and LCHF diet is much better in decreasing the liver, fatty liver. Liver stiffness also, if you look at it, 5:2 diet is much better in that category. There's, again, the point is significant reduction in the fatty liver based on this study, okay? For 5-2. Now, let's look at the other parameters they looked at it. FibroScan results. If you look at it, 5-2 diet, minus 1.8 best, right? So the 5:2 diet decreased the fatty liver, and they look at the CAP score. The lower the score is much better. Look at the 5:2 diet, minus 63.8 difference, okay? Again, very good in, they did when they did the CAP score, it's extremely less, in 5-2 diet after the intervention. ALT also, ALT change in 17. AST did not show much changes, but all the things kind of say 5:2 diet is much better. The low carbohydrate diet also good, but if I had to make a statement, 5:2 caloric restriction diet, where you do 2 days, you do caloric restriction, has worked extremely well in decreasing the liver fat. So let's look at anytime when you analyze a study, you have to look at the strength. What is the strength of the study? The strength of the study, this is a randomized control study, and they measure different tools, which is at the highest in sensitivity and specificity to measure the outcome, okay? And there's no pharmaceutical support for this study. And then weakness, the other main weakness I would say probably, if I have to look at the weakness, is the dietary pattern. It's very hard for people to control. They can tell you, I'll follow this diet. Can you do that on a daily basis? Kind of hard. So you should have excluded the people when we use the statin drug, that can affect our fatty liver. So they could have excluded that people. And some of the CAP level score was incomplete. That's also a problem. So what's our conclusion based on this study? The caloric restriction can decrease hepatic steatosis, especially this 5-2 diet can reduce hepatic steatosis or fatty liver. Okay, so our conclusion based on this scientific study published in Journal in Hepatology, 5-2 diet with which is a calorie restriction diet, can significantly decrease the fatty liver disease. Thank you so much for watching. Please subscribe to our channel so we can produce more scientific analysis of papers like this. Okay, please subscribe. Thank you very much. Bye.